Hello, my name is Lynn Kish, and I'm an Information Services Librarian at the Norris Medical Library. My job is to provide education and research services, primarily to the Keck School of Medicine, and I'll be following Dr. Samet's modules with these brief sessions to help connect you to EBM resources at the library. So today I'll be going over the following: how to locate EBM resources at the Norris Medical Library, provide a brief overview of EBM practices, show you how to formulate a searchable research question using Pico as a guide, and lastly, review the pyramid of EBM evidence. So starting with library resources, you can start with the Norris Medical Library website. The Norris Medical Library website can be a little overwhelming for a starting point, and so I usually recommend our LibGuides. LibGuides are sites that were created by librarians that focus on resources relevant to a topic. So we have a LibGuide dedicated primarily to evidence-based medicine, and that information can also be shown on the Year 2 Student LibGuide. So let me show you how to get to those. So to find evidence-based medicine resources, you can start on the Norris Medical Library homepage. The Norris Medical Library homepage on its own can be a difficult starting point, and it's easy to be overwhelmed by all the library resources. I often recommend LibGuides, which are sites that are created by librarians that highlight appropriate information and resources. So we have one dedicated specifically to evidence-based medicine, and you can find that similar information on the Year 2 Student LibGuide for medical students. So here's the Norris Medical Library website, and I just want to show you how to find these two LibGuides. To find the evidence-based medicine, you'll start under this key resources section and click by subject. This will then take you to an alphabetical listing of all our LibGuides. I know that evidence-based medicine starts with the letter E, so I'll click E, and I'll find it listed here, evidence-based medicine. Once I click that, it takes me to the guide where you have different sources of information, including the 5 steps of EBM. You can find the same 5 steps on the Year 2 medical student page. So starting again at the Norris Medical Library homepage, you can click Students, Medicine, and Year 2. If you haven't visited this site before, I highly recommend it and going through the tabs because there's a lot of great resources for you, including exam prep. But for EBM, you'll find it under the tab here, EBM Intro. And this has a lot of the definitions and the process that I mentioned before. It also has a list of tutorials if you want more information. The one I recommend the most is the one from Duke University. If you go under step 1 for Ask, this is where you'll find an overview of Pico. And if you go to step 2, Acquire and Access, you'll find a simplified evidence pyramid, as well as different resources that you can use for your evidence-based medicine research. And that's it for the website. So the steps of evidence-based medicine you may have seen on the guide I just showed you, but I'll go over them again. The first is to ask and create a searchable research question. The second is to acquire information and evidence. Once you have the information, you appraise your results critically. You apply the results to your patient, and then lastly, you assess and evaluate the effects of step 4 and reformulate your question and repeat as necessary. You'll notice that I highlighted the first 2 in red. That's because that's where the library can help you the most, and that's what I'll be focusing on today. So let's look at Pico. Pico is an acronym that can serve as a guide to formulate a searchable research question. So using Pico, you can pull information from a clinical scenario, and so Pico stands for the problem in the patient, the intervention that you're considering, your comparison to that intervention if there is one, and lastly, the outcomes that you're going to be looking for. So now let's look at a scenario. Francine is a 78-year-old patient who is being treated for mild hypertension, but is otherwise healthy with no chronic diseases. She has very little sensation in her lower legs due to poor circulation and walks with a cane. She lives alone and is concerned about falling. Her son just read an article about vitamin D and calcium. He strongly urges her to start taking vitamin D plus calcium because the article said this could prevent accidental falls. She asks you if vitamin D plus calcium really helps prevent falls. What does the evidence say? So here you have a lot of information, and I'll show you how Pico can be helpful. Our problem or patient are accidental falls in a 78-year-old woman. The intervention that I'm considering is vitamin D plus calcium. My comparison would be if we did nothing at all, so I'll say that's none. And lastly, the outcome I'm looking for is to reduce the risk and prevention of injury from falls. So why this is helpful is that you can then take that information to create your question: does vitamin D with calcium prevent injuries from falls among elderly female patients? I'm also going to be able to easily pull terms for my search strategy. And lastly, I'll be able to go back to Pico to evaluate if my question's been answered or not. The next thing I want to show you is the evidence-based pyramid of publication types. This really helps to iterate the point that not all journal articles are created equal, and it does this in 3 different ways. First, it's very common for evidence at the bottom of the pyramid to build up to the top of the pyramid. For example, it's very common, for something that's observed in a cohort study to then be applied to a randomized controlled trial. And then all that information in primary studies is then synthesized in systematic reviews and guidelines. Another point this pyramid makes is that as you go from the bottom of the pyramid up, the quality of information increases. And thirdly, as you go from article types from the bottom to the top, you'll find fewer articles of that type because it takes more time and resources to achieve a guideline as opposed to a case control study. So the way I would recommend thinking of this pyramid is when you start your research, start at the top of the pyramid and then go down. You want to see first if the highest quality information is available. So if you can find an evidence-based guideline, that's great, but if you can't, then step down the pyramid and look at systematic reviews. If you can't find a systematic review on your topic, then look at randomized controlled trials and keep going down the pyramid in that pattern. So that brings us to the end. I just want to review what we went over today. I showed you how to access EBM resources on the Norris Medical Library homepage. We provided a basic overview of EBM practices, including ask the question and acquire the information and evidence. I showed you how to formulate a searchable research question using Pico. And lastly, I provided a brief overview of the pyramid of EBM evidence. So thank you so much for your time today. I hope you found this helpful, and I look forward to further sessions with you showing you how to look for specific resources using databases and other library resources.